we have received confirmation that 4 people have tested positive for the disease. They include 1 Kenyan and 3 foreigners from America, Cameroon, and Burkina Faso. This now brings to 42 the number of those who have tested positive for the virus in Kenya. Today, our medical teams have embarked on a mass testing for all those persons who arrived in the country last week and are currently under mandatory quarantine in various designated hotels and government facilities. We want to appeal to all Kenyans to embrace the fight against coronavirus, as opposed to assuming that this is a government affair, because it is not. And to that effect, it is really, really wrong and disheartening for those particularly in leadership to continue perpetuating false information that have got nothing to do with the real cases, trying to gain political mileage out of a disease is as immoral as anyone could ever imagine. It is the worst of what we can see in terms of political maneuver, and it is wrong. It symbolizes everything that is wrong with our society. For instance, we have noted that misinformation is doing the rounds in social media, where a leader in the country is claiming that there are over 7,000 people in mandatory quarantine. And while this may ultimately be the case, and even perhaps even more people might get into quarantine, it is simply at the moment not true. So why would you wish, as a leader of society? It sounds like a wish. Why would you wish that 7,000 Kenyans should be in quarantine? And why would you think that the government is not telling you the truth? To hide it for what purpose? So it's really disheartening. And for the record, we have 2,050 people currently in mandatory quarantine in 14 designated places, in hotels and government designated places.
Within Kenya, there are more than 50 companies that are capable of providing some of these medical inputs. We started obviously with things like sanitizers, and we've seen a large number coming to the market. Our textile sector has confirmed that they have capacity to be able to make the PPEs, and we're in conversations also with our motor sector to see if they can also make some of these ventilators. They've not had to do it in the past, but they have that capacity. So we are confident, working also with our scientists and our engineers, that we can build greater capacity to be able to supply these goods within the country.
Nashukuru ya kwamba tumetengeneza county emergency response teams ikiwa pamoja na county commissioners, national government ikichanganyika na county national government na county government wakiwa wanafanya kazi pamoja. Leo mumesikia umuhimu ya kufanya kazi pamoja, serikali, wananchi, viongozi wa dini, viongozi wa siasa, ili tuweze sisi wote katika kila county tushiriki, tukae pamoja na tuone ni namna gani tutashinda hii ugonjwa.